I'm Dr. Olivia. I work at Coastal Integrative Health as a physical therapist. So today I'm going to talk about what is balance, the basics of balance, everything that kind of incorporates the topic in general. Part 2 and 3 will be a little bit more about strength and flexibility as well as balance techniques that you can do at home. So to start off, what is balance? So basically it's just maintaining your center of gravity over your base of support, being able to distribute weight equally between your feet, and being able to remain in a position without falling. So 3 components of balance are going to be your visual system, your somatosensory or proprioceptive system, and your vestibular system. So we'll break down each of those. So the visual system basically is your eyes. It's the ability to see what's in front of you, where you are, if something's coming at you. And with that, a lot of us end up having visual dependence. It's very common because, as you know, if you close your eyes, you probably feel a little more off balance, or if the power goes out, or you're in a dark area, you feel a little more unstable. It's just because that feedback is a little more limited. And that's because we can't see as much with the eyes, so we become a little more dependent on that. For safety reasons, you do want to make sure that you have night lights or lights on in the hallway if you get up to go to the bathroom at night, or if the power goes out, you have a flashlight nearby. That way you have the ability to see what's around you rather than walking in the dark. The next system, so somatosensory and proprioceptive, I'll break them both apart. So somatosensory is the conscious perception of touch. So you think about the touch of your feet to the ground, your fingers to a surface, anything like that is somatosensory. Proprioception is the awareness of the position and movement of your body. So knowing that, like, if I move my hand out to the side, I know I'm moving my left hand out this way. It's the brain's ability to determine that. So both of them together are sensitive to stretch and pressure of the muscles and tendons in your body. So that's how your body is able to realize, like, are you standing on an incline? Are you standing on a flat surface? Are you walking? Gives all the feedback back to the brain along with that visual system. Because of that, sensation of your feet can be very important. So if you have neuropathy or lack of sensation of feet, sometimes wearing shoes can be helpful because you don't want to step on something sharp or attack or anything like that. And be careful when you're on unlevel ground as well as level ground, as that sensation can change as well. Safety-wise, like I said, you want to make sure you're wearing shoes and make sure that you talk to your doctor if you have any numbness in your feet so that can be addressed as well. The last system is vestibular system. So that is responsible for the motion and head position as well as spatial awareness of your body and your head together. It's a component of your inner ear. You have different tracts and systems in your inner ear that determine if you're accelerating, deaccelerating. If you're turning your head side to side, looking up and down, it determines what motion you're moving. With that, there are a lot of difficulties that can come with this system, as people who have vertigo, BPPV, which you may have heard of before too, Meniere's disease, and many others. Those can affect that inner ear and can cause you to feel a little, like I describe it as kind of swimmy or off balance when you're moving. These can be addressed by a primary doctor as well as a vestibular PT that can give exercises as they're certified in that. That's where you may notice some difficulty, like in the grocery store, if you're walking around and you turn your head to look at something and you kind of feel like you fell off balance. That's your vestibular system needing a little bit of work because the head turned and the body thought it needed to go with it rather than moving independently. So it's just some facts about balance. Balance can decrease as you age. It's just a factor of those 3 systems we talked about before. Deficits in those systems can cause balance to decrease, as well as the ability of decreased strength and decreased muscle flexibility can also cause a decrease. As you know, we talked about it went with the somatosensory part. Vection is just a neat little fact. If you think about the idea where you're on a train and the train you're sitting on is not moving, but a train next to you or an airplane is moving, and you instantly, your body feels like you're moving, but you're not actually. That's a confusion of different sensory systems happening. So your vision is telling you you're moving, but your body is telling you you're not. So it's a confusion that causes you to feel like you are. That's called vection. A lot of people will kind of stop that from happening by looking out the other window and seeing something that's not moving, and then your body feels fine. Also, they have correlated migraine-associated vertigo. So there are some studies that have found that migraines may be related to some vertigo problems as well. So with balance, you want to be very careful with falls, as this can lead to about a quarter of people each year have falls, and it's the leading cause of fatal injuries, most common non-fatal traumas in related hospital visits. This is about 3 million injuries in the ER per year. So to be preventative with this, you do want to really focus on your balance. You want to talk to your doctor, evaluate your risk for falls as well as your medications, as some medications can cause dizziness or unbalance and you may not know those symptoms of it. Make sure you work on your strength and balance exercises, which are things we'll talk about in part 2 and part 3, as well as having your eyes checked to make sure that your vision is correct, or if you need glasses or the ability to have lights on in the house when you need to, and making sure your home is safer, which we'll talk about in a couple slides. Getting rid of tripping hazards, grab bars, railings on both sides, and brighter areas. So these are some different ways that you can check to make sure your home is safe to prevent falls and loss of balance. So a lot of what it shows is, stairs and steps, making sure objects are off them, fixing anything that's loose if the carpet is loose or any pieces of wood. You want to make sure everything is lit well in your house. You have handrails where you need to, especially bathrooms, railings on staircases too. You want to make sure any throw rugs that easily move are out of the ground or have a sticky pad underneath to hold them. Kitchen, be careful about reaching to things, the high shelf. Try and move things that are a little bit more shoulder or eye level that you use frequently. Bedrooms and bathrooms, same thing, making sure lit well and making sure there's nothing on the ground that you can slip on. The next thing are just kind of taking actions for yourself and those that live in the house with you. These are all part of the study materials that you can find online. So taking action, speaking up, keeping moving, keeping active, checking in with your doctor, checking on your medications, as well as the making the home safe, things we talked about in the slide before. And then this is just another slide with that on there where, talking to your doctor about your risk of falls as well as your medications, exercising for balance, strength, and flexibility, making the home safe, and making sure that your eyes and feet are checked for good vision and good sensation. And like I said, the next couple are going to be talking about strength and stability and flexibility, as well as setting yourself up for success when you get up from a chair and start to walk, and then going over balance both statically and walking dynamically. If you have any questions though, feel free to reach out to us at the office or through Amy or Holly or the Senior Center facility leader. Thank you.